Yeah, yeah, my name is Kedar Prasad. I will discuss today on prevention and improved treatment of diabetes by micronutrient mixture and you can collagen peptide and probiotics. As you know, diabetes mellitus is a progressive chronic associated with enhanced level of fasting glucose and hemoglobin A1C. And there are three types of diabetes, as you all know: diabetes type 1, diabetes type 2, and gestational diabetes, which happens during pregnancy. But today I will focus on diabetes type 2. The trend of diabetes is increasing, at least in the US and worldwide. For example, in the USA, in 2015, the prevalence was 30.3 million among 18 years and older population. But in 2024, it increased to 38.4 million. And the total cost of treatment in 2022 was $4 billion. In the world, in 2015, the prevalence of diabetes was 415 million people suffer from this disease. And in 2024, it increased to 800 million. And I also found out that in the Dubai, in 2019, 62% of population had diabetes, and 11.6% of them had pre-diabetic conditions. So as you can see, the trend is increasing all over the world. And the question is how to prevent it and how to improve the current treatment. First, we have to know also how insulin. As you know, the insulin is one of the treatment of diabetes. And insulin also in a normal individual, how it regulates your glucose level in the blood. So this is the function of the insulin for a normal person. After a meal, elevated blood sugar level in the pancreas send a message to the pancreas to send insulin, which then binds to its receptors. And that activates a signal molecule called AKT, which send the message to glucose transporter 4, and that you migrate to cell surface membrane, which then allow entry of glucose inside the cell for generation of energy. As you can see that this is very important function, that glucose transport, the insulin has to bind with the receptor. And if the receptor gets damaged, then glucose cannot enter into the cell. Now, in order to know how to prevent the diabetes and how to improve the treatment of diabetes, we have to know what are the external factors which initiate type 2 diabetes. And also we have to know what are the internal risk factors that initiate diabetes. And if we know these, then we can easily propose the idea of a prevention as well as improved treatment of diabetes. And you can see that external risk factor include obesity. And in the US, 70% of the people have either overweight or obese, metabolic syndrome, lack of physical activity and smoking, high consumption of sugar and fat, micronutrient deficit diet, excessive exposure to environmental toxin, and of course, pre-diabetic condition. These are the external risk factors. The question is, can we control it? The internal risk factor which initiate type 2 diabetes, internal risk factor include increased oxidative stress and chronic inflammation, which happens in all people. Then what happens? The insulin receptor, if this thing exists in your body, the insulin receptor are damaged by oxidative stress and inflammation, which prevents the activation of signaling molecule, and this causes a failure of glucose transporter to send the message to migrate to the cell surface and allow glucose to come in. So the receptor damage, this is the main, very important issue. How to reduce chronic inflammation, because this is one of the major factors which initiate diabetes because it damaged the insulin receptor, and then subsequent process can be implemented. Other internal risk factors and which promote diabetes, and these internal risk factors have not drawn enough attention, and this is very, very important. One of them is intestinal dysbiosis, in which the number of harmful bacteria increase and the number of beneficial bacteria decrease. And this intestinal dysbiosis occurs as you grow older with or without any disease. And it is associated with almost all human diseases, including cancer. So this is very important, how to handle the intestinal dysbiosis. And of course, in case of diabetes, this is also very associated. A reduced production of digestive enzyme, as you know, as we grow older, the production of digestive enzyme decreases, and this has to be taken care as well. Increase uptake, this is very important, increase activity of dipeptidase or DPP4 enzyme, which reduces the flow of insulin from the blood, from the pancreas to the blood. So this DPP, in a short, we call him DPP4 enzyme. So this enzyme increases in case of diabetes. So insulin, furthermore, insulin-resistant patient diet, if the patient becomes resistant to medication, oral medication and insulin, then they can develop diabetic-related complication. As you know, there is a damage to the eye, peripheral neuropathy, nephropathy. So that's very dangerous thing to go through. But if this is very important to know how to prevent them. You can see the prevalence of major complications in diabetes in the US. Retinopathy is 4.1 million diabetes. Nephropathy is 37 million. Kidney disease is terrible. And 786,000 have end-stage kidney disease. 71% of them are on dialysis, and 29% of them require kidney transplant. And 50% of diabetic patients develop peripheral neuropathy, which is also very painful. 90% of diabetic patients have increased risk of heart disease and a stroke. And also, if no prevention, if it is not treated, and you have a food damage, it can cause, it causes 50,000 people require amputation per year in the United States. So how do you reduce the risk factor for prevention of diabetes? Obviously, we all know it, and it has been suggested for decades. Consumption of low-fat, high-fiber diet with plenty of vegetables. Reduce consumption of excess sugar, carbohydrate. Daily moderate exercise. Lose weight if you are overweight. Stop smoking and reduce stress. Also, reduce exposure to environmental toxins. This has been suggested by many the federal and private agency, but despite these kind of recommendations by federal agency or private agency, the incidence of diabetes continue to increase because human behavior with respect to diet and environment is difficult to change. They don't follow it. Nevertheless, we must try to adopt these recommendations as much as possible. The recommended guideline to reduce internal risk factor, for example, oxidative stress and chronic inflammation for prevention of diabetes. We all know that supplementation with a scientifically prepared micronutrient mixture containing multiple antioxidants would protect insulin receptor against oxidative and inflammatory disease. Such a protection would allow signaling molecule AKT to send a message to the glucose transporter protein to migrate to the cytoplasm to the cell surface, which then allow the intrium glucose inside the cell for generation of energy. These cellular changes will reduce the level of blood glucose and hemoglobin A1C. So this is very important to reduce oxidative stress. And so you have to remember it, that this is the most important event that you can do for prevention is reduce in your body, oxidative stress. Not only diabetes, but many other poor health can be avoided. And there are some other as I mentioned, there are other internal risk factors for diabetes type 2. Since intestinal dysbiosis contribute to the initiation and progression of type 2 diabetes, daily supplementation with probiotics, with prebiotics would reverse this harmful effect of intestinal dysbiosis. But not many people know it. They know it. I have published this information, so you can find it. But in a doctor office, when you go there, nobody asks how is your intestine. But this is very, very important. Since reduced production of digestive enzyme in older individual is associated with diabetes 2 may decrease. And if it is the case, then absorption of micronutrient and macronutrient is also decreased. Therefore, daily supplementation with the digestive enzyme may improve the digestive ability of the intestine and therefore improve your health. Another very important point here is that people are not very aware of, since increased activity of DPP-4 enzyme reduces the flow of insulin from the pancreas to the blood in diabetes, supplementation with the collagen peptide. And this collagen peptide is very important because this collagen peptide would inhibit the activity of the DPP-4 and therefore allow the flow of the insulin from the blood, from the pancreas to the blood, causing reduced accumulation of glucose in the blood. And so, as I said, there are several oral medications, as you know, metamorphin, sulfonylureas, peptide DPP-4 inhibitors, sodium glucose co-transporter inhibitors. These are Ozempic is most recent one, and insulin. These are there, available. Excuse me. As you know, excuse me, metamorphin is the first drug used to treat diabetes type 2. And when the patient develops resistance to this drug, additional drug is added. And whenever that, excuse me, and whenever the patient becomes resistant, they keep on going on adding a new medication, which work by different mechanism. Current treatment of drug, which is sometimes require multiple oral medication, and if people become resistant to oral medication, then they give insulin. And when they become resistant to insulin, then they develop to all kind of complications. Current drug treatment have slowed the progression of type 2 disease, no question about it. However, diabetic-related complications do develop rather slowly in some cases, despite taking more than one medication. These are all facts. These drugs do not. Why? Because these drugs do not affect oxidative stress or inflammation. Therefore, diabetes continue to progress rather slowly. Proposed plan to improve the drug treatment in diabetes of type 2 is the same thing. Daily supplementation with a micronutrient mixture would reduce the risk of developing diabetes and improve the effectiveness of drug because we are addressing the oxidative stress and chronic inflammation. Increase activity of the DPP-4 enzyme, as you know, they reduce the release of insulin from the pancreas to the blood, and therefore daily supplementation with collagen peptides would inhibit the activity of DPP-4 and thereby improve the flow of the insulin from the pancreas to the blood. Since intestinal dysbiosis contribute to the development and progression of type 2 diabetes, daily supplementation with probiotics, with prebiotics reverses the above effects of intestinal dysbiosis. Sometimes patient develops insulin resistance. And then what you do? Then there is omega-3 is surprisingly, omega-3 is one of the very only agent that I know which can directly activate the signaling molecule AKT, which then send message to glucose transporter to migrate to the cell surface membrane and allow glucose to come in. And so omega-3 supplementation is also very important for diabetes. And this was shown in a double-blind placebo-controlled trial, the value of collagen peptide because it inhibits DPP-4 enzyme. Drug group fasting glucose level was 125 milligram, you expect that. Collagen peptides plus drug group fasting glucose drops to 105 milligram. Same thing, drug group had a A1C level 6, but collagen peptide plus drug group shows decrease to, I think, decrease to 5. Collagen peptide plus drug insulin, they decreased to 5. And also insulin resistance decreased from 6 to 5. So you can see that collagen peptide has a very important role in the management of, in combination with drug, or if you're in early phase, you may not have to take a drug. But anyway, so in this way, we feel that we can both prevent it as well as in combination with drug, we can improve the management of diabetes. In conclusion, proposed plan to improve diet, lifestyle, and environmental exposure toxin have had no impact on prevention of type 2 diabetes. Nevertheless, we must continue to educate people that these are important issues for prevention of not only diabetes, but many other chronic diseases. A recommended plan to use a macronutrient mixture, probiotic with prebiotics, collagen peptide, omega-3, would be beneficial in prevention. And the same recommended plan in combination with medication would further improve their effectiveness and reduce the progression of the diabetes, leading to decreased incidence of diabetic-related complications. Thank you very much for your patience.